have to tell us what the Nigerian Medical Association is doing now.
This critical public health issue in Nigeria. The excessive use of high sodium foods and the urgent need for stricter regulations to protect the health of our people. The theme of today's briefing, Bouillon Fortification, Public Health versus Profit, highlights the tension between public health and commercial interests and the steps we must take to prioritize the well-being of Nigerians. Nigeria is currently facing a dual burden of malnutrition and a rising prevalence of non-communicable diseases, such as hypertension and cardiovascular diseases. A significant contributor to this health crisis is the excessive consumption of sodium, primarily through processed and packaged foods, including widely used seasonings like bouillon cubes and monosodium glutamate. Bouillon cubes, a staple in many Nigerian households, are heavily marketed as essential for enhancing flavor and adding nutritional value to meals. However, these products are alarmingly high in sodium content. Some of them have sodium content as high as 70%. So, while food fortification is intended to address micronutrient deficiencies using high sodium foods as vehicles for fortification is counterproductive and poses significant health risk. The World Health Organization recommends a daily sodium intake of less than 2 grams, equivalent of 5 grams of salt a day for adults. Yet, many Nigerians consume far more than this due to the high sodium content in these commonly used products. Indeed, all of us in this country have acquired a taste for salt. And when there is no salt in the food, we say the food is tasteless. And that is the danger, the real danger that we face. Moreover, the marketing practices surrounding these products often mislead consumers into believing they are making healthier choices. Monosodium glutamate, otherwise known as MSG, for example, is frequently advertised as a safer alternative to table salt, despite its very high sodium content. This has resulted in widespread misinformation, further exacerbating the public health crisis. The need for immediate action to reduce sodium intake among Nigerians is clear. High sodium consumption is directly linked to the increasing rates of hypertension and cardiovascular diseases in the country, conditions that are placing a growing burden on Nigerians' healthcare system. That is why so many young people now are slumping and dying at very short notice, and without intervention, these trends will continue to worsen, leading to higher mortality rates, reduced quality of life, and increased healthcare costs. Implementing front-of-pack labels or labeling is a proven strategy to help consumers make healthier food choices. Front-of-pack labeling provides clear, easily understandable information about the nutritional content of packaged foods, particularly in relation to sodium, sugar, and saturated oils and fats. By enabling consumers to make informed decisions, front-of-pack labeling can play a critical role in reducing sodium intake at the population level. In addition, enforcing global best practices in the development and implementation of the nutrient profile models for packaged foods will ensure that products available in the Nigerian market meet established health standards. This will not only protect consumers, but also promote production and availability of healthier food options. The key objectives of this press briefing today: one is to decry the use of high sodium foods for fortification. We call attention to the alarming trend of using high sodium foods such as bouillon cubes as vehicles for fortification. While fortification aims to address micronutrient deficiencies, the excessive sodium content in these products poses significant health risks. High sodium intake is a well-established risk factor for hypertension, cardiovascular diseases, and other non-communicable diseases, which are becoming increasingly prevalent in Nigeria. We must not compromise public health in the name of fortification. Two, correcting deceptive marketing practices. The deceptive marketing practices that have misled many Nigerians into believing that monosodium glutamate, otherwise known as MSG, is a healthier alternative to salt must stop. This misinformation, often propagated by influencers and advertising campaigns lacking scientific backing, has contributed to the rising incidence of hypertension and cardiovascular diseases in our country. It is time to enlighten the public about the true health implications of consuming these high sodium products. The third objective is advocating for front-of-pack labeling, and we advocate for the adoption of front-of-pack labeling on packaged foods, as well as the enforcement of global best practices in the implementation of nutrient profile models. Front-of-pack labeling is a crucial tool for empowering consumers to make informed choices about the foods they consume. By implementing front-of-pack labeling, we can help Nigerians make healthier choices and reduce the burden of NCDs. So therefore, today, we are urging the Federal Ministry of Health and Social Welfare, the National Agency for Food and Drugs Administration and Control, NAFDAC, and other relevant agencies, including SON and FCCPC, to accelerate preliminary activities for salt and sodium regulation in Nigeria. The time for action is now. We must prioritize public health over profit and ensure that the food products available in our markets do not pose unnecessary risks to the health of our citizens. In conclusion, we call on all stakeholders, including the government, civil society organizations, the private sector, and you in the media, to join this campaign. Together, we can drive the change needed to protect the health of Nigerians and create a healthier future for our nation. Thank you.
To convene with you. And today, alongside our partners and well-meaning Nigerians, we address you as a matter of concern and urgency, as we will continue to do, since there are also unrelenting efforts by corporations who are focused on derailing the progress our country is making in the areas of public health. We acknowledge the critical roles that the Nigerian government, civil society organizations, local communities, major stakeholders, including some industry, must play to ensure that Nigeria's health and nutrition needs are met through multi-sectoral approach, an approach where no vulnerable group is left out. Following the launch of the National Food Consumption and Micronutrient Survey report, some key policy decisions were proposed which have raised concern about the intent or proponents of those ideas. And among them is the consideration of bouillon cubes, which we call Maggi. Bouillon cube is not bouillon van. Bouillon cube is those cubes that we use to spice up our soup. So the consideration of bouillon cubes as a vehicle for delivering iron and zinc to households in order to combat macronutrient deficiencies in Nigeria. And the justification for this policy proposal is based on survey findings that bouillon cubes are consumed by 96% of our population. However, this approach defies one of WHO's criteria for food vehicle selection, which states that a suitable food vehicle must not pose threats to public health. Resulting from the fortification of salt with iodine, which we all know, Nigeria presently records an average daily salt consumption reaching up to 10 grams per day, dangerously exceeding the WHO organization's recommended limit of 2 grams of sodium per day, or less than 5 grams of salt per day, which is just equivalent of 1 spoon of salt daily. Our fear is that fortifying another high sodium food, such as bouillon, puts Nigerians at risk of a higher sodium intake. What we are saying is that those cubes are already high in sodium. And when you are now fortifying them, you are indirectly making them to consume more sodium and the associated risk. Furthermore, certain industry players and their co-travelers are disseminating unverified scientific information, false research claims, and spreading deceptive marketing information through social media influencers to promote monosodium glutamate, MSG, and bouillon as nutritious, safe, and healthy for human consumption, without also informing consumers that these products contain harmful quantities of sodium, which could lead to hypertension, heart, and kidney failure. I'm not sure whether some of us will come across new digital media campaign, including even newspaper articles now, talking about how safe MSG is. What we are saying simply is that sodium is actually the problem, and MSG is what? MSG is sodium. The recent food insecurity and economic crisis in our country has led to a significant rise in the living expenses of Nigerians, where the masses can no longer afford basic food items, such as garri, giving industries the edge to produce cheaper and ready-to-use ultra-processed alternatives with low nutritional and health benefits. In such situations where nutritious food is costly, people only feed to satisfy hunger. However, it's our responsibility to ensure that Nigerians don't eat poison and they eat healthy and so as to stay healthy. Today's briefing is aimed at drawing the attention of our policymakers, industries, and the public to the rising burden of non-communicable diseases in our country and the rising slump attack in the country. What do we mean by slump attack? I think recently you must have heard stories or heard or friends or somebody you know just slump and will not recover. And such attacks, the so-called slump attack now, could be linked to poor cardiovascular health resulting from loopholes in the existing food safety policies and regulatory mechanisms, which have greatly impacted the quality of food produced, marketed, and consumed by Nigeria. To this effect, we are demanding the immediate discontinuation of the ongoing plans to use bouillon as a food vehicle for fortification, as it does not meet all of WHO criteria. Collaboration between all critical agencies on ensuring that food fortification does not exacerbate Nigeria's NCD problems through unintended consequences. Implementation of front-of-pack labels and enforcement of global best practices in the implementation of nutrient profile models for packaged foods in Nigeria. And that the government should regulate the marketing and promotion of high sodium foods, especially marketing to vulnerable groups such as school children. And lastly, that government implement effective countrywide source sodium reduction intervention to stem the ugly tide of the rising burden of slum attacks and hypertension in our country. We're also urging our media friends to be on alert, to be deliberate in checking for misinformation that may come from certain individuals or groups that are also calling themselves experts in nutrition and in health, who are working tirelessly to undermine efforts to promote the health and nutritional well-being of the Nigerian people. For emphasis, it is imperative that regulatory bodies such as the Ministry of Health, NAFDAC, Standard Organization of Nigeria, and the FCPC collaborate to monitor those fortification programs to ensure compliance with global best practices, especially in the selection of food vehicles. It is also important for the different MDAs coordinating nutrition, food safety, and consumer protection programs in the country to collaborate closely to ensure that food policy decisions are well scrutinized to align with overall sustainable development goals and national objectives on nutrition, so that we can stem this tide of the rising non-communicable diseases in our country. The lives of our people depend on those decisions, and we encourage the Nigerian government to promote public health in all its policies on food and nutrition. Thank you very much.
The implementation of healthy food policies in Nigeria, majorly with our focus on the fortification of bouillon, which we all know that is a food that is high in sodium and can actually put Nigerians at risk of hypertension, which is a major risk factor for kidney failure and heart failure. So I'm here to explain some of the technical details. Presently, Nigeria actually faces a triple burden of malnutrition, which means that as a country, we are battling with undernutrition, overnutrition, and micronutrient deficiencies. According to the World Health Organization, micronutrient deficiencies are common to low and middle income countries. However, micronutrient deficiencies, particularly iron, folic acid, iodine, and vitamin A, are a global public health concern. Micronutrients usually perform a range of functions. And when we talk of micronutrients, we're talking about vitamins and minerals. Part of the functions that they perform include production of enzymes, hormones, and other substances that help the body to function optimally. So when we do not have sufficient vitamins and minerals in our bodies, we develop micronutrient deficiencies like anemia. Other effects of micronutrient deficiencies include impaired brain function. When the body is lacking in certain nutrients, it affects growth, it affects development, it affects brain function, it affects production of hormones, amongst several other functions. So, to tackle the scourge of micronutrient deficiencies in Nigeria and its attendant health problems, we can only manage it by consuming safe, diverse, and nutritionally balanced diets. On a countrywide scale, to combat micronutrient deficiencies, it requires a concerted effort. In other words, we need to adopt a multi-sectoral approach. One of the approaches include the implementation of agriculture-sensitive interventions to boost food security within the country, food fortification programs, therapeutic feeding for children and women who are down with acute malnutrition. So we identify that food fortification is actually an evidence-informed public health intervention that is endorsed by the governments of different countries to tackle micronutrient deficiencies. However, as much as it is crucial to tackle micronutrient deficiencies, we must ensure that whatever food vehicle that we select, when we talk of a food vehicle now, we're talking of foods that are largely consumed. That's foods or condiments that are largely consumed. So the reason behind the choice of salt was that salt is largely consumed by the populace. So salt was chosen and fortified with iodine. Now, what food fortification does is it picks largely consumed foods and staples, and then it fortifies it. It adds micronutrients like vitamins and minerals to it so that the larger populace can have access to these nutrients. So the goal is to improve nutritional quality of our food and deliver public health benefits. But those public health benefits must be delivered with zero health risk. I don't know if that makes any sense. In other words, when we're choosing a food vehicle, we must choose a food vehicle that does not pose any health threat to the populace. The National Food Consumption and Micronutrient Survey actually revealed that food fortification programs in Nigeria have not achieved so much. And part of the reasons, it says it has had minimal impact over the last 2 decades. Part of the reasons is that Nigerians consume more of locally unprocessed foods than processed foods. I can give you an example. Majority of Nigerians would rather mill their corn to make tuwo than buy wheat flour that has been fortified with vitamin A. So, already, according to the World Health Organization, the fortification of salt with iodine already puts countries at the risk of high consumption of sodium. This is because people believe that once a food is fortified with a micronutrient, the demand for it increases. There are people who believe in Nigeria that the more salt you consume, salt has the ability to cure goiter, which is false because it has been fortified with iodine. Now, fortifying bouillon in addition to salt, it means that we're giving Nigerians, if Nigerians need to consume iodine, they go for salt, and then if they need to consume iron, they go for bouillon, which means that there will be increased demand for 2 different high sodium foods. Already, just by the high consumption of salt in Nigeria, which is more than double the daily recommended limit by the WHO, Nigeria, of course, on television, I think a prominent officer slumped in active service. There was another prominent musician that died in an event. She slumped and died. These are traceable to heart attacks and, risk factors associated with hypertension. So in a nutshell, given that Nigeria already has a mandatory salt iodization program, we are actually proposing that, we're advocating that we do not go ahead, the National Fortification Alliance and all competent agencies sit together, collaborate and work together to come up with effective policy decisions that will help Nigeria to reduce their sodium intake, because already we're in a very bad place. Part of, according to the National Multisectoral Action Plan, one of our major goals to tackle non-communicable diseases in Nigeria is to help Nigeria to reduce their sodium intake by 30% in the next 5 years. So fortifying bouillon makes that effort counterproductive. It means that rather than reducing our sodium intake, we would actually be adding bouillon, which is a high sodium food, to the salts that we're already consuming in excess. Taking examples from countries like the United States of America and India, Nigeria can actually learn some lessons from these countries, in the sense that these countries, rather than fortify multiple high sodium foods, they decided to do a double fortification of salt, In other words, since salt had already been chosen for mandatory fortification for iodine, they went ahead to fortify salt with iron also to tackle. You can work with just salt and fortify only salt with both iodine and iron. Now, the reason why salt can be used is because the sodium content of salt can be further reduced from 40% to a healthier quantity that is good enough for the populace without tampering with the concentration of iodine and iron that is added. I don't know if that makes a lot of sense. How? Okay. All right. So I'm saying that Nigeria can learn from countries like the United States of America and India. Now, these countries, instead of fortifying different high sodium foods and making their people, fortifying a particular food product makes it attractive to consumers. For instance, there's this breakfast beverage that they advertise. They say it helps children to get brain development vitamins and minerals. Recently, a research showed that the same beverage has dangerously high amounts of sugar that can expose your children to diabetes and obesity. Now, the industry will never tell you that this product has dangerous amount of sugar that is harmful for your health. However, they will use the micronutrients which they have added, which is the brain development vitamins, for advertisement. And when parents hear it, who doesn't want his child to be intelligent? You go for that. However, compliance to even most of these standards by industries is very low. Not all industries actually fortify these products with these nutrients. Yet, these products are harmful for consumption. In Nigeria, when reports have actually shown that Nigerians consume more of unprocessed staples than processed foods, why are we choosing ultra-processed foods for fortification? Why can't we actually choose our commonly consumed unprocessed staples like rice? In countries like Brazil, they fortify rice with iron, considering that it is widely consumed by the populace and it poses no health risk to the people. So, just to stay in time, in a nutshell, what we're saying is the choice of a food vehicle must align with all of WHO's criteria. And one major criteria is that if you're choosing a particular food to fortify it with nutrients, it must pose no risk to public health. Bouillon poses a huge risk to public health by giving the people hypertension. Now, you cannot say that you want to fortify bouillon with iron. You are tackling anemia, but giving the people hypertension, because the concentration of sodium in bouillon is way higher than the concentration of sodium in salt. So it's a complete no-no, and we're saying that it's not a good food vehicle. There are other food vehicles the government can learn from best practices across other countries like the United States of America, Brazil, and India. Also, in conclusion, we want to say that the Federal Ministry of Health and NAFDAC actually do have a responsibility to safeguard the health of Nigerians, and we are counting on them absolutely to do so, because the life of millions of Nigerians actually do depend on these policy decisions. Our ask is this: we're asking that before these major policy decisions are made, the Federal Ministry of Health, Consumer Protection Agencies, Standards Organization of Nigeria, all key agencies, even within the Federal Ministry of Health, the different departments should sit together and review these decisions to ensure that it aligns with our collective national public health goals. Because it's possible that a department in the Federal Ministry of Health wants to promote the fortification of bouillon, but it does not align with the policy goal of another department within the same department. So we ask for more collaboration amongst these agencies. It's important for all these ministries, departments, and agencies coordinating nutrition, food safety, and consumer protection programs to work together to closely ensure that food policy decisions are well scrutinized, to align with overall sustainable development goals, as well as national objectives on nutrition and public health, as this will help Nigeria to ease the rising burden of non-communicable diseases. Once again, the lives of millions of Nigerians depend on these policy decisions. Hence, decision makers and public health authorities must do all they can and in good conscience to save the life of Nigerians. Thank you very much.